So we are back at 10 minutes now past the hour.
A record 4.2 million Americans will turn 65 this year, making them eligible for Medicare.
Medicare's open enrollment period is right now, and it can be a lot to navigate. So we asked Abel Ebane, a health insurance manager with AAA Minneapolis, to stop by to answer some questions that he gets. Welcome.
Thank you. Happy to be here.
We're glad you're here. And the first question I asked you was, wait a minute, AAA, I think we all associate AAA with cars and roadside assistance and travel, but insurance?
Right. So this is a new vertical for AAA, right? It's really AAA taking the lead on what's happening with health insurance and healthcare, saying that we're going to help people.
Yeah.
Right? So we do Medicare, we do individual small business insurance. We really help people navigate that space because it's complex and complicated.
Yes.
So roadside assistance, yes, but also we offer travel health insurance guidance for members.
Okay, well, thanks for clarifying that. You're the expert. We got you there. So lay it out. What exactly is Medicare for those of us or people who are watching who aren't of a certain age yet?
Yeah, absolutely. So Medicare is a federal insurance program that's available to people 65 or older, or certain younger people with some disabilities, or if you have end-stage renal disease or ALS.
Okay.
You have access to Medicare. And that's managed by the CMS, so the Centers for Medicare and Medicaid Services. You know, in healthcare, we like to use acronyms and we like the alphabet. So Medicare is going to have parts. You have Part A, Part B, Part C, Ds, and all those that you need to put together for your coverage.
Okay, so Medicare, who enrolls in Medicare? There's a certain age.
Right. So the enrollment really depends on a few things, right? So when you're turning 65, you're entitled to Medicare. Right. So you go on Medicare Parts A and B. You have a window of 7 months. We call that the initial enrollment window when you can enroll into Medicare Parts A and B, right? Or if you're younger, or under the age of 65, you can enroll because you have a disability, right? And now, between October 15th and December 7th, you can make any changes. If you've been on Medicare for quite a while, you can make changes to your plan if you have an Advantage plan, also known as Part C. Again, we like the alphabet. Or if you have a Part D plan, which is your prescription drug plan, you can make changes to your plan between October 15th and December 7th. And that's why we're having this conversation.
We should break down the A, B.
Yeah, run down through not every one of them. Don't do the whole alphabet, but okay. A, B, C, D.
All right, so A, what we call original Medicare has two parts, right? So you have your Part A, which covers your inpatient benefits. So you have skilled nursing facilities, you have your home health care services, and some of your inpatient services. All those are paid for by Part A, Part A, which is your hospital insurance. You do not pay a premium for Part A. Then you have Part B, which covers your outpatient services. So we call that your hospital insurance.
Okay.
It's going to pay for certain services such as your CT scans, MRIs, X-rays. You have a premium for Part B, and that premium is really on the sliding scale. And that sliding scale really changes based on your income 2 years prior to the year you're going on Medicare. Most people in 2025 are paying $185 for Part B. Now, Part B has a deductible as well. That's an annual deductible. And you've heard of the famous 80-20. So you pay your deductible, then you get to the famous 80-20 coverage. Medicare pays 80% of your Medicare services, and you're responsible for 20% with no cap.
Okay.
I need to clarify that. There's no cap, so there's no point in time where Medicare will come to you and say you've met your maximum out of pocket. That's why you need to have something else in place to protect yourself.
Is that where Medigap comes in?
Exactly. You can be an expert too.
No, I just saw the word and was like, I've not heard of Medigap before.
Yes. So you have your Parts A and B, right? You have some expenses left behind by Medicare. So you have options. You can sign up for an Advantage plan, also known as Part C, or you can sign up for a Medigap plan, also known as a supplemental plan.
So is that kind of like gap insurance on your car?
Pretty much. So it's helping you cover what Medicare doesn't cover.
Okay.
And the common misconception is if Medicare doesn't cover, my Medigap is going to cover. No, it means Medicare is going to pay first. If you have a Medigap plan, Medicare pays first. What's left behind is picked up by your Medigap insurance.
And can you base your Medigap insurance, is there a different level of quality that you can get by paying on a certain tier, or how does that work?
So the way it works with, again, we have two or three types of plans going on,
yeah.
right? So you have Advantage plans. Part C, those are all-in-one plans that will help you pay for your Part A, B, and prescriptions. That's one plan, one card, one bill, right? And then you have your Medigap plan. Depending on the premium, so the more you pay in premium, the lesser you pay in copays when you have a Medigap plan. And Medigap plans, something to highlight here, Medigap plans do not cover prescriptions. So you need to get a separate prescription drug plan. They do not cover dental, so you need a separate dental plan. They do not cover
no
vision.
wonder people are so confused.
You need a separate
Abel.
vision plan. That's why we're here. That's why AAA is here, and really because it's confusing. It's a confusing space, and we want to make sure that we're really guiding beneficiaries to the plan that's going to make sense, for themselves. Yeah.
So, what's the difference between Medicare and Medicaid?
Yes, that's a great question. That confusion comes up multiple times when we meet people, even when they've been on Medicare for quite some time. So Medicare is available to people 65 or older, or under 65, as we said, with certain disabilities.
Conditions.
That's managed by the federal government, right? And then when you look at Medicaid, as I would explain it to my mom, Medicaid is really, we're helping people with limited resources, right? So you have limited income, you'll be on Medicaid. That's income driven. And it offers a broader spectrum of coverage compared to Medicare itself, because it would add things like rides, meals that you have access to when you're on Medicaid. Can you be on both? Sometimes you can. If you turn 65 but you don't have enough assets to say on Medicare only, you will be what we call dual eligible. So you have Medicaid and Medicaid, and then there will be coordination of benefits within the two programs.
Okay.
So if you are done working, or not even if you're done working, if you just turned 65 years old,
Right.
do you have to get this type of insurance?
Not necessarily.
Okay.
Not necessarily. So you're turning 65.
Yeah.
You can stay on your employer's plan, but there are things that you need to make sure are true.
Yeah.
Right? You need to make sure your employer's coverage is creditable. Otherwise, you end up paying a penalty, and that penalty never goes away.
Oh, sure.
So when you sit down with a trusted advisor, they will ask you a series of questions to make sure that you're checking all the boxes that you need to check. So turning 65 doesn't ipso facto mean that you need to go on Medicare. You can stay on your employer's plan if they allow you to do that, or your significant other's insurance plan.
What about Social Security and Medicare? Can you, because I know people can start collecting Social Security at 62, but not everybody does.
Right.
So do you need to be on Social Security to qualify for Medicare?
No, you do not need to be on Social Security. So the way it works is those two programs are linked, but they're also separate. If you're collecting Social Security before turning 65, Medicare will automatically enroll you into A and B when you turn 65. Then you can find Part C, an Advantage plan, or supplemental plan, right, to supplement your coverage. But if you're not collecting Social Security, you will actively need to enroll into Medicare, and you can delay your Social Security, because a lot of the members we meet with say they want to delay Social Security until they can max it out. So two separate programs, they talk to each other, but one doesn't necessarily mean that you have to get the other one.
So I'm guessing there's somebody out there who's this is their first year. They're doing open enrollment. It's their first year at 65,
Right.
And their head is spinning right now because of everything that they just heard. So they can call people like AAA.
Absolutely.
And then how do you guys get involved?
So where we get involved is really at you're turning 65, right? We can help you from point A all the way to your enrollment into an Advantage plan or supplemental plan, whatever is going to work for you. So if you need to talk to your HR and you don't know exactly what questions to ask, we can help you with all of that. If you need to enroll into Part A and B, we can walk you through that process and make sure that you're answering questions the way that you need to answer them, and to really prevent you from paying a penalty or making a mistake that's going to delay your coverage.
Sure.
So reach out to us, call us. AAA has experts that will be able to assist you throughout the process. And now is really the perfect time to do that. So reach out to us, because we know it's not news to anyone here that carriers are leaving counties.
Yeah.
Right? And then a significant carrier is leaving the Advantage market altogether. So what's that doing is it's creating a shopping event. Almost 200,000 people are looking for insurance. It's confusing.
Yeah.
Right? So if you've been on Medicare for a long time, you never looked at your annual notice of change. This year, this is my call to action to you, actually.
Don't wait.
So don't wait. Look at your annual notice of change. If it's complex and complicated, which it is, AAA is here to help you. We can absolutely assist you with all that.
Abel, thanks for stopping by.
Absolutely.
Good,
Happy
gosh,
to be here.
good luck. If you have questions about Medicare open enrollment, you can get a hold of Abel and the team at AAA Minneapolis. We'll put their contact information for you at minnesotalive.com.